Welcome everybody in our NPR International School. In our school we teach for all medical sciences, for medical doctors, for dentists, for osteopaths, for physiotherapists, optometrists, all the medical science who deal with the health of the patients. In this particular course, this particular mini course, we will teach for dentists the concept of T.M.J's therapy. In our point of view, we said that T.M.J's is part of the craniofacial system, the whole craniofacial system, and the craniofacial system is connected with the rest of the body. We cannot talk about just T.M.J's. In this mini course that we call it T.M.J and posture, we will teach you how to do the diagnosis, the posture, the diagnosis of the craniofacial system, the posturometry, and mainly the treatment, the combined treatment, the interdisciplinary treatment between two specialties of the medical science, who is the dentist and the osteopath. An interesting and very important collaboration, but we need also that is a necessary collaboration. If we think at the T.M.J's as part of a system in the whole body, we need these two specialties to work together. In this mini course, you will understand why we said that and how to deal with this important collaboration. I hope you enjoyed that mini course. NPR, it is myofunctional and postural rehabilitation. That means NPR. NPR, it means functional rehabilitation of the whole body. And this is our protocol. And we will show you, in our point of view, how you have to make the diagnosis and mainly the treatment of the craniofacial system. We talk about the T.M.J's and posture, craniofacial dysfunction and posture. It is a very important topic, but we are talking here about an holistic and interdisciplinary approach. Holistic and interdisciplinary approach. What do I mean? They mean holistic, the whole body, diagnosis and treatment, and interdisciplinary, interconnection between different disciplines of the medical sciences. In this particular case, dentistry and osteopathy. In this mini course, we will do an introduction of the concept. We will teach you how to do a holistic diagnosis and interdisciplinary treatments, and you will see some cases treated with the NPR concept in craniofacial system dysfunction. Okay, a little introduction in this mini course. This is my CV for the people who do not know me. I have 47 years experience working in medical science, and I am a specialist in craniofacial orthopedics and expert in postural disease. I am a medical dentist. And in this mini course, I will explain to you the concept of our school, how to make the diagnosis and the treatment of the craniofacial dysfunction. This is a little opinion of our students, what they said when they were formatted in our school. A little experience they have. I have a lot of students in my career. I've formatted more than 3,000 people in the protocol. Some of the comments. the little comments of my students. And then we go just to introduce you in our point of view regarding TMJ. TMJs have different functions, the temporomandibular joint, interview in the speech, in the training, etc., etc., etc. But the main concept is that TMJs alone is nothing. As you see there, it's part of a system, part of the craniofacial system. And the craniofacial system is part of our body. There is not treatment isolated. We have to treat, we have to deal all together. We cannot treat just TMJs. The craniofacial system is an important system. In this area, we have the central nervous system and the stomatognathous system, two important parts of our body. Craniofacial system is composed of several bones and muscles that they have to work in harmony, but in harmony between them, but in harmony with the rest of the body. The jaw is part of this complex system and is the one we have mobility, big mobility, but sutures, little bones of our cranium, they move. In the case of the jaw is the bone who has more mobility and more adaptation. But this mobility, however, is conditioned by dental occlusion. When we close the teeth, they block the jaw position, even if it's a good position or if it's a bad position. The correct functioning of the craniofacial system depends mainly to have a balanced mandibular posture. And this posture depends to stay there if we have a good functional occlusion. The result will be an optimal local balance with the general balance. And if you remember, with dentists, a lot of times we are talking about the central relationship. For us, it's a focus. But I think we have not clear why, and we have not clear how to obtain that. We cannot obtain that position only manipulating the jaw, only dealing with the occlusion, only dealing with one technique to put the jaw in that position. It is impossible. You will see among the curves that it is impossible. But we know that we have to have a good central relationship. In this mini course, you will understand, you will learn that when the position of the jaw is altered, it will affect one of the most important receptors of our body, who is dealing with the posture, with the tonic postural system, and it is the oculomotor system. Imagine, the jaw is affecting the eyes. You say, why? What happened? What is that? Someone can say, it's not impossible. It's impossible, but it's not impossible. You will see. It will affect. The jaw position affects this and more in our body. And that's why it's important to have a very, very good centrated jaw. It will affect chronically our foot support. You will see in this course. You say how? How the jaw can affect the foot support. Don't forget, our body is all interconnected. We are not disconnected, and you will see during the course how it's happened, and you understand how to treat it. This jaw position, forward position, retro position, lateral deviation, intrusion, all of this, for different reasons, you will see that in this mini course, they will affect the whole body. That's why it's very, very necessary to work together different specialities in this kind of treatment. And for that reason we was talking before, we need absolutely and holistic diagnosis. All the different parts of the system of our body are interconnected. Any action or interferences affecting this body. If I am doing some treatment here, we will have a reaction in the bottom, and vice versa. Any treatment or any disease or any problem we have in the bottom will affect the top. For that reason, it's very important to have a holistic point of view, not just a sectorial diagnosis. Important this concept because any actions of each specialist can interfere with the other. It's very necessary to understand this concept, to have an interdisciplinary point of view and interdisciplinary treatment. Interdisciplinary collaboration with the same protocol that allows us a truly successful treatment plan. If we work together with the same optic, with the same concept, speaking the same language in diagnosis and treatment, that will be very, very benefits for our treatments. In any treatment, it is necessary the relative therapy. In this case, we are talking now when we do some dental treatment or something with the dentist in the craniofacial system, we need the help of the therapist. In that case, with the osteopaths. Osteopathy and physiotherapy, very successful tools that contribute to a physiological and lasting results in the treatment. If you understand, it's very difficult to treat alone the patient, but also very difficult to treat in an interdisciplinary way if we don't speak the same language. It is important to speak the same language, each medical science. In our masters, in our courses, in our school, we work together, we study together. In this case, it's a master of craniofacial orthopedics, as you see there, and we work with an osteopath who is teaching our students also. This is a master for dentists. Interdiscipline, very important. And also, it's very important, the interdisciplinary treatment. Not work alone, ever. In the R.M.P, treatment protocol is based in three concepts. Very simple, very logical. Deprogramming, rebalance, and reprogramming. And then the consolidation of the treatment. Deprogramming the craniofacial system in this case, in order to allow a good postural balance, because you will see in this course, craniofacial system is the main and big disturber of the posture, and we have to treat it with a very good concept, functional concepts, interdisciplinary concept When we say reprogramming, in that case, we are dealing with the jaw reprogramming that will do the reprogramming of the whole craniofacial system. We call that progressive reprogramming. What we do with it? We will found the central relationship of the jaw. And at the end, we will keep that position with a very good functional occlusion. You will see what we mean about all of this in this particular mini course. The NPR protocol is based in the sensory deprogramming. What I mean sensory deprogramming? We can, if we understand the craniofacial system is a disturber, we have to keep him out of the body, but we cannot take the head and put it out. We have to deprogram the system. We have to deprogram the system. In this moment, we are eliminating the negative effect that the craniofacial system produces into the postural tonic system. If we do that, we can allow all physiotherapists, osteopaths to do a good body rehabilitation. Once the postural balance is obtained, then we do the sensory reprogramming of the systems. In this particular case, the sensory reprogramming of the craniofacial system, putting the jaw centrated in a good vertical dimension. We can do only that if we have global balance. If it's not, it's impossible. We cannot that only treating locally. And how we do the deprogramming with a special device, the BET device. You will see in this mini course what it is and how to adapt it and how to work with this. To deprogram the craniofacial system, the BET, the name is Body Equilibrium Device. That eliminates the aggression to the tonic postural system. It is not a bite, a normal bite. And it is not a normal reformating device. It's a special device. With a special material, you will see in that mini course the difference. That allows us to take it out, the aggression into the tonic postural system. And after that, body balance, and then reprogramming the craniofacial system. We do that with the reprogrammer, the functional and postural reprogrammer, and we do that progressive, craniomandibular progressive reprogrammation. Sometimes you will see we use functional microplanes. All this when the growth is finished. We use the microplanes generally in prosthetic and orthodontic rehabilitation. During the growth, we use the craniofacial orthopedics. It's a good specialization to do that during the growth age. You will see this case, some samples how we do that. And then we see some clinical cases of this protocol. First thing, I want to show you how the mandibular deviation or the change of the jaw position can affect the posture, just to understand these cases. Look at that. Lateral deviation, hypoconvergence. You will see what is hypoconvergence during the posturology diagnosis in this case. Left eye hypoconvergence. And look at the posture. When the patient closes the mouth from 1 kilo to 6 kilos. Look at 1 kilo of overload. Mouth open, close the mouth, and then 5 kilos overload. This measure is with the posturometer. You will see in this verse also what is a posturometer. But look at, this is the proof. It's an objective instrument that shows us that the craniofacial system dysfunction can affect absolutely the posture of our body. Another patient, mandibular deviation to the right, look at hypoconvergence. And if you see the posture, 3 kilos, mouth open, and look at this, close the mouth, 4 kilos. Overload of the posture to the right, to the left. You will see all of these things in this mini course. Third observation. This is a forward position of the jaw, produced bilateral hypoconvergence, and look at the reading. Jaw position forward, high, the both eyes cannot move. Perfect. But look at something. Here, mouth open, mouth closed, no overload. But this situation, the forward position, changed the posture sagittal. Normally, forward position is changing forward, normally and mainly. Retro position is changing back, not overload, but always changing the posture, changing the body center. This is the explanation and the proof that craniofacial dysfunction affect the posture. That was part of a research I did in 1990. Measured that, studied that, the connection between jaw position, oculomotor system, and posture. And then we see a quick picture of some patients. Look at this patient who has position of the jaw very bad. Look at the posture. Torsion, stress in the tonic postural system. Look at that. Patient with the jaw position no right, open mouth, closed mouth. 0 kilos, 2 kilos. Look at here. 1. Look at here the instability of this patient. Look at this. This is instability. The body is moving a lot when the patient closes his mouth. Look at here, adaptive scoliosis. Scoliosis is a symptom, it's not a disease. Adaptation of the colon when we have something on the top, something on the bottom, in the middle adapt. And here, patient with the craniofacial system dysfunction, a real short-legged postural dysfunction. How we can treat it alone? It is impossible. And in that age, we can prevent the situation. That's why we said prevention is medicine. In that age, in this particular age, when the child is growing, you can change it. Craniofacial orthopedics is a physiological treatment, very important to prevent in the future the T.M.J disorders. Craniofacial orthopedics with this device, which is a myofunctional and postural regulator, the ROCA, that I invented more than 40 years ago. Now is used all around the world, in different countries, in different continents, different universities use it. Craniofacial orthopedics stimulate the growth and guide the growth. That allows a good and correct growth, no dysfunction in our body. This is the main goal. craniofacial orthopedics, the discipline that during the growth age is working. This is the device we use, and this is the prevention. That plus interdisciplinary therapy, neuromuscular reeducation can prevent the whole problem in the future in an adult. This particular therapy has a direct corrective effect on the muscle change, and as a consequence over the whole body. Thank you for listening. Thank you to stay there, and I hope you will go through this magnificent mini course where you will learn the concept of craniofacial system disturbed and the rest of the body. Remember, it is not only T.M.Js. We have to change that concept. We cannot say T.M.J disorders. It's craniofacial disorders and postural disorders all together. And the only way to treat it is to have the mentality of interdisciplinary treatment and mainly holistic diagnosis. Connection between the whole medical sciences. I hope you will enjoy the course. I hope you will enjoy the mini course, and you can apply this fantastic concept in your private clinic. Enjoy the mini course of T.M.Js and posture, craniofacial disorders and posture in an holistic interdisciplinary